Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Everyone, welcome to Research Perch. I'm Michael Reynolds, the chair of the marketing committee for the Massage Therapy Foundation, and I'm glad you're here. We're here with Nikki Monk and Ruth Warner. Ruth, how are you?
I'm great, Michael. How are you?
Excellent. Nikki, you doing well?
I'm doing fantastic. Thanks, Michael.
Great. So good to be talking to both of you. So as you know, if you're listening and watching, Research Perch is a podcast for massage therapists to help you kind of unpack and understand articles from the IJTMB, which is the International Journal of Therapeutic Massage and Bodywork at ijtmb.org. So today's article we're discussing is Correlates of Injury-Forced Work Reduction for Massage Therapists and Bodywork Practitioners. The title alone is kind of a mouthful for me. I'm having a hard time even just kind of digging into this. It was very difficult for me to really kind of unpack this myself. So I'm really glad we're talking about this. So I know, Nikki, would you be willing to start us off and kind of maybe translate this into slightly different terminology that might help me understand what this study is about?
Certainly. Well, I think one of the big pieces to highlight first off is that this study and this article is really highlighting something that's really important in the massage therapy field, and that's this idea of injuries from massage, performing massage, keeping us from being able to work, either having to reduce our load or possibly contributing to burnout. So this is certainly an issue that's very important to massage practitioners. And basically what they're doing, the title, as you say, it is a mouthful, and correlates is basically what are the things that have an association with injury-forced work reduction for massage practitioners. So what are the things that could lead to this, cause that, etc.
Okay, and that means, and again, just to ask a dumb question, your injury-forced work reduction just means time off because of injury or something that inhibits them from working as a massage therapist, right?
Potentially. So either having to step away for a while or not being able to see as many clients as they would like to or as they once did. In fact, they actually quantify this for the purposes of this study. They have two questions that they ask, and they ask how much they agree with or disagree with the statements, I can no longer work the hours I previously worked due to occupational injury. And then the second one is, I can no longer treat as many clients per day due to work injury. So it's getting the information, a sense of how much injury or pain is limiting their ability to see patients or see clients.
Okay, got it. So what were the correlates? What affected this?
All right, well, let's back up a little bit and talk about what the study design was, and then we'll go to what their correlates were.
Okay, sounds good.
So this is a secondary data analysis, and it's actually a really large data set in the scheme of things. And basically what happened was they invited people involved with the AMTA or the ABMP to participate in an online survey that was going to be looking at job satisfaction and job progression for practitioners. And this was a secondary data analysis where they wanted to take just particular issues to answer their question of what are the correlates to work-related injury. And some of the data that they had gathered was things looking at accumulated costs of the profession, so how much money and time they invested in the profession, and then also how much continuing education costs and those sorts of things, and then also the kind of exhaustion variables, so how burnt out are they, how tired are they, how physically tired are they, how emotionally and mentally tired are they. Other kind of variables that they were looking at were occupation identification, how much they identified with it, how happy they were in their employment, and
the correlate to that is how trapped they felt in their employment. There was a whole series of questions or a whole discussion about whether you wanted to leave the profession but you felt that you couldn't because you had no other training or you had no other options.
Right, and these are really important issues in other fields, especially people who feel like they're trapped in their jobs. And it wasn't necessarily that they were expecting this to be the case for massage therapists, but because these are issues that are very strong correlates in other work-related injury type work reduction situations, they wanted to look at that as well. So yes, very, very good point there. And so The secondary data analysis actually ended up being a little over 2,000 people who participated, and this is out of the original 7,500. And basically what happened was in the original survey there were two surveys. The first one was really, really long, and most of the folks continued that, but then only 45% of those did the second part of the survey, which is what all of this data was based on. So we didn't get they weren't able to get the full effect of those who responded. And they expect that they actually reached out to about 75,000 massage and body work practitioners.
And just to clarify, it was a nice cooperation between the AMTA, the ABNP, and also the Federation of State Massage Therapy Boards, who all were willing to share some survey space to collect information about how people feel about their jobs.
Yep. Really, really great opportunity. And they also collected some demographic information on folks. So it as wouldn't be unexpected, majority were female, 80% were female, most were white. Certainly does reflect what the massage therapy practitioner pool looks like. Most folks had an associate's degree or higher in education, and the age range was primarily between mid-30s to mid-50s for practitioners. And then basically what they have two hypotheses that they test. And one of them is, the first one is that accumulated costs is associated. The higher people feel they have accumulated costs, that the higher probability that they're going to have this injury-forced work reduction. That's the first hypothesis. The second hypothesis is that exhaustion variables, the more tired people are, the more likely they are going to be to have injury-forced work reduction. That's a mouthful.
Yeah, and I want to clarify there for Nikki again that exhaustion, they made two subsets of it. One was physical exhaustion, and another was sort of mental emotional exhaustion.
Yes.
So Nikki, maybe you were going to explain this already without me asking, but I guess I'm really curious. The second part I get if you're tired, if you're exhausted, that can lead to feeling more apt for injury. But the first part where you said the more they invest in education, did I hear that correctly?
Yes, well, and not just invest in education, but how much does it cost to be a part of this field? So the amount of money it costs to get your education to begin with, and then the cost that you have to continue to do financially and just emotionally and time-wise to be invested in the profession to be a part of it. So that was one component of it. And then second... Go ahead, Ruth.
Yeah, go ahead, Ruth.
Yeah, is it fair to say then that what they're looking at is like a sense of a return on investment? That if people felt like they weren't really getting a good return on their financial and otherwise investment, they were more likely to feel, to get injured or to feel that they have to pull back because they're not strong?
I think what it's more getting at is, so if somebody feels like they've put all this time and energy into something and that they're not getting that self-fulfillment, and maybe this is exactly what you said and I just heard it differently, and they're not getting that sort of satisfaction, not necessarily just financially, but they don't feel that it's beneficial to them or that it's really nurturing them, if you will, for lack of a better term.
Looking for. Yeah.
Right. That those people who feel that the cost is just too high to be involved are going to be more likely to be injured or have this reduction need. So that's what they...
I guess I'm still kind of confused about that, because at first I was seeing this as going in the direction of here's certain factors that affect how much you have to take off work due to injury, but it sounds like this is more of a study of how people feel. Am I understanding that correctly? You're really surveying how much people feel the ROI is not there based on, I guess, the nature of their job as a massage therapist, or am I still not getting this?
Well, it could be. And so these questions, these variables were derived from self-report Likert scales, okay? And a Likert scale is when you have, for instance, 1 to 5 rating, 1 being...
usually an odd number, right? And
it does tend to be an odd number, yes. There is a middle number, so somebody can do 3, which is, neither on the high end or neither on the low end. But one would be, for the purposes of this study, all of the statements had one being that they strongly agreed with whatever the statement was, okay? So for, let's see, I think they even have some examples of what the accumulated cost set was. So one of the statements was, I have too much time invested in massage therapy to change occupations. So if somebody said a 1 on that, that would be strongly agree, okay? So that would have them be a very low number. So we can, we could actually, we'd have more information if we had the whole list of questions, and I'm sure that if you contacted these folks, they would give you what those questions were. But it gives you an idea that the higher the number in this case, the poorer the outcome, if you would put it that way. So if somebody strongly agrees with the statement that I have too much invested to change fields, these are the folks that are going to feel perhaps trapped. They've got too much time invested to even change. But then if you look at that with somebody who, in job satisfaction, for instance, they have a high job satisfaction. I love my job. They strongly agree to that. Okay, so I don't know what the questions were, but when I look at table 1, and I know that for those of you who are listening, the table 1 is this really great from a statistical standpoint visual aid to be able to see what all of this data means. The score for job satisfaction is high. It's a 5, okay, is the medium term for that. And so that tells me that these folks have high job satisfaction.
That the people who took, let's remember, this is self-selection for the people who answered the survey. So it wouldn't be surprising to find that most of them had high job satisfaction. Right.
And then for the accumulated costs, this number is rather on the lower side, so it's 2.76. So the burdensomeness of cost for these folks are relatively low. Okay.
Pretty neutral in a case, yeah.
Yeah. So the table that most of you can't see.
Unless you download the article from
unless you download the article. So while I'm looking at this, it's a really interesting kind of table because it has a really strong diagonal, and so it looks like half of the information is missing. But the reason for that is that the everything that's going down the list is also going across the table as well, and they go with the same numbers. So you can kind of look and see where the accumulated costs variable aligns with the job satisfaction variable. And when we go and look across associated costs to job satisfaction, there's actually a pretty low correlation there, which lets you know that those are two very independent factors, for one, but that it doesn't necessarily mean that the higher somebody feels the accumulated costs are, isn't necessarily going to negatively affect their job satisfaction.
Okay, so the amount of money someone spends becoming a massage therapist, investing in continuing education, investing in their business, that's not necessarily showing a direct relationship with their job satisfaction.
Right.
Okay.
But the outcome of interest for this particular study is the injury-forced work reduction. And when you look at this table again, and now you look across all the different variables that they include. They look at job satisfaction, effective occupational commitment, et cetera, you look across there and look to see what the high correlates are. And so a correlate variable is going to be, the strongest correlate is going to be 1. And then the rest of it is reported in a decimal, okay? So high decimals, 0.98 would be a very high correlate, okay? 0.75 is a pretty strong correlate as well, all right? 1 being the perfect correlation. So now as you look at workforce injury-forced work reduction, the strongest correlates are going to be physical exhaustion at 0.5, and then, that's physical exhaustion is, 0.5, and then work exhaustion is about 0.4. So those are the highest correlates with that.
And by work exhaustion, this is what we were talking about before with sort of the mental and emotional preparation and investment that we make when we see clients.
Yes. Yes. And so, and this is just setting up, these are what all the correlates were, and these are what the pieces that we look to test our hypothesis. And then the next step that they do in this study, and this is getting very statistical and researchy, if you will, then they're going to test particular models to see how much variance of the report is attributed to some of these different issues. And here again, they find through these statistical methods, they find that the most important factors are the exhaustion pieces, as they suspected. So that was their second hypothesis. But then also with the associated costs, rather than the accumulated costs of the profession, it was the costs of continuing education obtainment that was most related to injury-forced work reduction. So in other words, if somebody felt, the more somebody felt imposed upon or that the cost of getting continuing education was burdensome, the more likely they were to have this injury-forced work reduction.
Interesting.
So,
yeah, go ahead, Ruth.
Yeah, so my question, Nikki, and I'm embarrassed that I can't answer this because I also read the study, but as we've hinted, it's really dense, and I'm not comfortable in that world. So we see a correlation between people feeling like or having the perception that continuing education is too expensive to invest in, and those are the people who are more likely to do less work because they've gotten worn out. Are they also the people, I mean, feeling like continuing education is burdensome does not necessarily mean people don't do it.
True. Very true.
Right? And so do we have any playing out of those differences? I mean, people can do their continuing education and just, resent it because it costs that much.
True. Right. And so this is an inherent limitation of studies like this that have narrow-ish questions that were asked. Mm-hmm. And they actually do, the authors do a really nice job of pointing out some of the limitations from this survey type piece. And this is one of them, because they don't ask the question, how much continuing education have you taken in the past?
Right. Well, I really like Ruth's question, especially because at first when I was listening, I was hearing you say, and incorrectly obviously, I was hearing you say that the more continuing education someone invests in, the more likely they are to not be able to work as much because of injury, but that's actually incorrect. It's actually based on their attitude toward continuing education. So the correlation seems to be, or the association seems to be, their attitude toward investing in continuing education that's showing a relationship between that and their how much they can work due to injury. So that I find even much more interesting.
Yeah, isn't it?
Yeah, and without the actual questions, let's see, the second two item, study-specific scale, continuing education costs, was measured, and a sample item is, so they had two questions, and one of them was, it costs too much for me to take required continuing education. And I'm assuming that the other question is somewhat similar to that. It didn't ask, I don't know what the other question was, but I can't imagine that it was, I don't take continuing education, or I do take it, and then you have to quantify that with a Likert scale. Because that's a yes/no question. But what would be really interesting would be to see, in future studies, you could actually do the same sort of thing, asking about injury-forced work reduction or leaving of the field, and seeing how much continuing education they've logged over the past bit, and not only the amount of continuing education, but the type of continuing education. Perhaps it is that body mechanic type pieces, or going back to the principal foundation pieces, would be much more beneficial in something like this than new techniques or something else, for instance. That probably wasn't a very good example.
Well, yeah, and I of course would want to know why that is, and of course we can't answer that. I've got some theories. I'm sure we all have some theories about why that is, and we can't really answer that, but I would want to know a little more, because that's, like I said, I've got some theories about that. I'm sure you do too.
Sure.
And I'll tell you what, let's take a quick break. One, because my head hurts from all this research discussion, but two, because we need a quick shout out to our sponsor, which is Anatomy in Motion. So I do want to definitely give a shout out to our sponsor. Anatomy in Motion is an awesome app. It's for iPad and iPhone and iPod Touch, all iOS mobile devices. And it's really an app that is an educational tool for massage therapists, for body workers, for chiropractors, for PTs, for anyone who works with the human body. It shows the layers and structures of the muscle systems of the body, and it is absolutely gorgeous. I know, Ruth, you're a big fan. You bought your iPad specifically to use Anatomy in Motion. Yes. So we definitely appreciate their support for the Massage Therapy Foundation and for sponsoring Research Perch, and they're most active on their Facebook page. So I would recommend that you go to Facebook and just do a search there for Anatomy in Motion, and it's very active. They've got their number of followers are in the 6 figures. They have a very active Facebook page, a lot of great content there. You can download the app from the website there, and of course search on the iTunes App Store. So big thanks to Anatomy in Motion. Appreciate their support. So again, I going back to the correlation between attitudes toward education and injury forced work reduction. Very interesting to note that. Again, I'd like to learn more. But again, as a massage therapist, what does that mean to me? The practicing massage therapist who's listening, why should they care? What is that? How can they use this information?
I'd like
Ruth,
to
go ahead.
On that one. While I found this article very dense and it was a struggle to get to the nut of it because I'm not practiced in that. Maybe my favorite section of the article was a concluding section on implications for practice. And they draw some conclusions which may or may not be accurate, but I thought, coming to this realization that there is a connection between how massage therapists and bodywork practitioners feel about getting continuing education is to some extent a predictor of their risk for burnout or for physical exhaustion. That's a really important thing for people to know, both for people entering the profession, but also for providers of continuing education and for bodies that require continuing education, whether that's mandated by state license or by membership of an organization, like if your state might require continuing education, or NCB or something like that. So as a CE provider, what I hear in that is it's really important to do 2 things. One is to provide continuing education that is going to really rejuvenate people, whether that has to do with hands-on or not, but to send people back into their session with a new sense of energy and commitment to their field. But also to do it in a way where people feel like it's cost-effective for them and a really good investment. And that's, to a certain extent, that's almost a marketing message. Yeah. There's another point I wanted to make about this, which is that this study has allowed, what it did was allowed these researchers to gather a huge amount of pretty picky data out of these surveys, and the only way to do that is when lots of people participate in a survey kind of project like this. And I wanted to let people know that there is such a thing that exists for massage therapists. It's called massagenet.org. And massagenet.org it's called a practice-based research network.
Or PBRN is how it's also referred to.
PBRN, Practice-Based Research Network. You can become a member of massagenet.org just by signing up. All you need to be is a massage therapist in practice. And when they have a survey of interest, you fill it out. And in that way, in a very cost-effective way, we can gather data from people all over the world on what is of interest to them. So it's as are many things in massage therapy research, it is currently underfunded. It is a project of the Massage Therapy Foundation. We helped to get it launched, but it has all kinds of fantastic potential, and I'd love to have our listeners become members of MassageNet so that when a survey comes up that is meaningful to you, you can participate in that.
And that's massagenet.org.
That's correct.
And it's also another way for practitioners who are interested in getting involved in research to have meaningful contribution as a participant in research. So I actually get quite a few email messages from practitioners. How do I get involved in research? It's a very general and vague question. For those of you who are interested in that, I'm happy to answer those questions with a little more specificity in your inquiry, please. But it is a great way to start getting your feet wet and being a part of the research community in that way.
Well, and while we're on that topic, we can also point out that there is an ebook at the foundation. There's a free ebook called How to Get Involved in Research, which gives some nice sort of steps from A to B that you can do if this is a field that is interesting to you.
Indeed. Yes. Go to massagetherapyfoundation.org and click on resources, and you'll find it there.
Good. Well, and I would say too that your favorite part was the practice implications for this article, and I agree. It was an excellent part. And for me, my favorite part of this was the very well-designed aspect of the study. And while it was challenging to read, in that it was very technically written. It was a very well done study. The methodologies were very well done. The statistics were very well done and described, while technically described, they were right on. And if that is something that is interesting to you, this article is a really nice place, dense though it is, to start looking at and seeing how data can be discussed, how it can be analyzed, and then work backwards for, okay, how do I do this sort of statistical analysis? How can I learn more about it? This would be a good article to use in that regard.
And given the critical attrition rate that we have in this profession, partly due to exhaustion and burnout, and partly due to financial and economic factors, and that speaks to people's burdensome attitudes toward continuing education. I think that what this study does is reveal the tip of an iceberg that really calls for more attention. I think the more we can shine a light on what helps people stay in the profession and feel fulfilled and successful at it, the better off we're going to be.
I agree.
Well, I love all three of our perspectives here because Nikki kind of pointed out her favorite part and Ruth's favorite part, and as the marketing nerd, my favorite part is this connection I'm seeing between marketing messaging and what this study is telling us. Because if I were a CE provider or an educator, I would look at this and download this and really dig into it and utilize some of the findings here to reinforce my message that continuing education is critical and vital and very helpful to massage therapists. I would really download this and dig into it if I were a CE provider. So I like making that connection as the marketing nerd.
Right. Well, and I think, to me, the next really important question is, what is the correlation between longevity in the field and the amount of time or the kind of investment people make in their continuing education?
Yeah.
And what kind it is, yeah.
Exactly. Yeah.
Many reasons to follow this very closely. So thank you so much to both of you. Really appreciate your insights. Really helped me understand this much better. So thanks so much for your time, Nikki. Thank you, Ruth. And thanks, everyone, for joining us today. If you're listening, be sure to go to massagetherapyfoundation.org, subscribe to our blog, check out all the resources we have there. If you're watching, look below. We have show notes there. We'll link to the article. And, of course, link to a way to subscribe to the podcast in audio format on iTunes or Stitcher for Android. And, again, ijtmb.org is where you find these articles that we've referenced during our podcast. So thanks so much for listening. Appreciate you joining us today, and we'll see you next time.
Thanks, Michael.
Bye now.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.